health authorities and international monitoring agencies are currently tracking a significant uptick in hantavirus activity, a development that has transitioned from a localized concern to a subject of global public health surveillance, following a series of high-profile incidents in early 2026. At the center of the current reporting is an ongoing cluster of infections linked to the MV Hondius, an expedition cruise ship that departed from Ushuaia, Argentina, in April. This specific event has drawn intense scrutiny from the World Health Organization and the Centers for Disease Control and Prevention, as it involves the Andes virus strain, one of the few hantavirus variants known to possess the potential for limited human-to-human transmission. While hantaviruses are typically categorized as rare, the recent surge in South America, particularly in Argentina, where case numbers have reportedly doubled over the last year, has prompted scientists to investigate the underlying environmental drivers. Research indicates that shifting weather patterns and the resulting ecological disruptions, often referred to as climate variability or catastrophe, are altering rodent habitats and population densities. This expansion of the virus's geographic range is bringing human populations into more frequent contact with infected rodent reservoirs, creating new challenges for clinics and labs tasked with early detection. +3. To understand the scope of the current situation, it is necessary to examine the fundamental nature of the pathogen. Hantaviruses are a family of viruses spread mainly by rodents, including deer mice, cotton rats, and rice rats. In the Western Hemisphere, exposure typically leads to hantavirus pulmonary syndrome, or HPS, a severe and often fatal respiratory disease. In Europe and Asia, different strains commonly cause hemorrhagic fever with renal syndrome, or HFARS, which primarily impacts kidney function. The virus is not typically airborne in the way seasonal influenza or other respiratory pathogens are. Instead, it is most commonly transmitted when a person breathes in air contaminated with the virus from rodent droppings, urine, or saliva. This process, known as aerosolization, frequently occurs during the cleaning of infested spaces, like sheds, cabins, or storage units. The current reporting emphasizes that, while the risk to the general public remains low, the increased frequency of these environmental interactions, coupled with the potential for human-to-human spread in specific strains, has elevated the priority of hantavirus surveillance in global health security frameworks. The core of the current public health response is centered on laboratory confirmation and the management of active clinical clusters. As of May 2026, the World Health Organization has confirmed a cluster of 7 cases among the 147 passengers and crew of the MV Hondius, resulting in 3 deaths. These cases were characterized by a rapid progression from initial symptoms of fever and gastrointestinal distress to severe pneumonia and acute respiratory distress syndrome. Laboratory testing conducted by the National Institute for Communicable Diseases in South Africa has been instrumental in identifying the Andes virus strain as the culprit. This facility, along with the Pasteur Institute in France, is utilizing advanced metagenomics and serology to track the genetic evolution of the virus and determine if recent mutations have contributed to the current outbreak's severity. Official statements from health agencies note that since June 2025, Argentina alone has seen overall hantavirus-related deaths rise from 28 to 101, a sharp increase that public health researchers attribute to environmental changes and increased human encroachment into previously isolated rodent habitats. This surge is not limited to South America. Surveillance data from the United States has recently identified hantavirus-positive rodents in San Diego County, while France's National Reference Center recorded 19 confirmed cases in the first quarter of 2026. +4 current developments also highlight the logistical and diplomatic complexities of managing a rare pathogen in a mobile environment. The MV Hondius was recently anchored off the coast of Cape Verde after being denied docking permissions, illustrating the caution exercised by national governments when faced with a virus capable of human-to-human spread. Despite the alarm, health officials are careful to contrast confirmed data with speculative claims. The CDC has stated that while the situation is being monitored closely, there is currently no evidence of widespread community transmission, and routine travel remains safe for the majority of the population. The focus remains on One Health coordination, an approach that integrates human, animal, and environmental health data to predict where the next spillover event might occur. Hospitals and clinics in high-risk zones are being advised to maintain a high index of suspicion for patients presenting with sudden-onset respiratory failure who have a history of recent outdoor activity or travel to endemic regions. The lack of a specific antiviral treatment or vaccine means that clinical management relies almost entirely on early supportive care, including intensive care monitoring and mechanical ventilation, which significantly improves survival rates when administered promptly. Prevention and rigorous public health surveillance remain the primary tools for mitigating the impact of hantavirus as global environmental conditions continue to shift. Public guidance issued by the WHO and the CDC emphasizes that the most effective strategy is the elimination of rodent contact. This involves sealing entry points in homes and workplaces to prevent nesting, particularly in rural or semi-rural areas. Health officials are particularly vocal about the dangers of improper cleaning techniques. They advise against sweeping or vacuuming areas where rodent activity is suspected, as these actions can kick up dust and aerosolize the virus. Instead, it is recommended to use a bleach solution to thoroughly wet contaminated areas before cleaning with gloves, and in some cases, high-efficiency respirators. For travelers and those engaged in ecotourism, staying in rodent-proof accommodations and avoiding areas with visible signs of infestation are critical steps. Surveillance programs are also being expanded to include more frequent trapping and testing of rodent populations to serve as an early warning system for local communities. Plus, on honest assessments of the current situation, acknowledge significant limits in our knowledge. The incubation period for hantavirus can range from 1 to 8 weeks, making it difficult for health officials to trace the exact moment of exposure in sporadic cases. Furthermore, while the link between climate change and increased rodent activity is supported by ecological data, the precise mechanisms that lead to a sudden surge in viral virulence remain a subject of ongoing study. There is currently no widely approved vaccine for the Andes or Sin Nombre strains, and research into targeted antiviral therapies is still in the developmental stages. As we move further into 2026, the focus will remain on stabilizing the current cruise ship cluster and preventing further spillover events through public education and international cooperation. For now, health agencies continue to urge vigilance rather than panic, noting that while the virus is formidable, it is also manageable through established hygiene and environmental controls. This report reflects the most current data available from global health monitors as they work to contain this rare but serious threat. For more updates on global health reporting, please consider subscribing to the channel. The diagnostic pipeline for hantavirus remains one of the most significant hurdles for public health agencies and frontline clinics, particularly as the frequency of spillover events appears to increase. Because the early symptoms of hantavirus infection, including high fever, severe muscle aches, and fatigue, so closely mimic more common respiratory or gastrointestinal illnesses, laboratory confirmation is the only definitive way to differentiate the pathogen from seasonal influenza or other viral threats. National reference laboratories, such as those overseen by the Centers for Disease Control and Prevention and the European Center for Disease Prevention and Control, utilize a multi-tiered testing strategy. This typically begins with enzyme-linked immunosorbent assays, or ELISA, to detect specific IgM and IgG antibodies that indicate a recent or active infection. However, in the acute phase of the illness, molecular testing through reverse transcription polymerase chain reaction, or RT-PCR, is critical for identifying the viral RNA directly from blood or tissue samples. These diagnostic procedures require high-containment facilities, often classified as biosafety level 3 or 4, due to the severe nature of the disease and the risks associated with handling live viral cultures. Agencies are currently working to distribute standardized diagnostic kits to regional hospitals to shorten the window between symptom onset and confirmation, as early intervention is the primary factor in reducing mortality rates. In clinical settings, the management of hantavirus is characterized by a rapid transition from a relatively stable prodromal phase to a critical cardiopulmonary stage. Hospitals in regions identified as high risk by recent surveillance data are being advised to monitor patients for sudden drops in platelet counts and the appearance of atypical lymphocytes, which are common laboratory markers of the infection. Once a patient enters the pulmonary phase, the virus causes a systemic increase in vascular permeability, leading to the rapid accumulation of fluid in the lungs. because there are currently no FDA-approved antiviral medications specifically targeted at hantaviruses, and ribavirin has shown limited efficacy in clinical trials for the pulmonary form. Treatment is strictly supportive. This involves the use of supplemental oxygen and, in severe cases, mechanical ventilation. In the most advanced clinical environments, extracorporeal membrane oxygenation, or ECMO, is utilized to provide temporary respiratory and cardiac support by circulating the patient's blood through an external artificial lung. The reliance on such resource-intensive technology underscores the strain that a surge in cases can place on regional healthcare infrastructure, particularly in rural areas where the necessary equipment and specialized staff may be in short supply. The scientific community is currently scrutinizing the relationship between ecological shifts and the increased viral activity mentioned in recent reports. The core of this investigation lies in the trophic cascade hypothesis, which suggests that extreme weather events, such as the heavy rainfall and warming temperatures associated with climate variability, lead to a surplus of food sources for rodent reservoirs. This phenomenon, often called a masting event, results in a population explosion of the specific mice and rat species that carry the virus. With higher rodent densities, the prevalence of the virus within those populations increases, subsequently raising the statistical likelihood of human exposure. Surveillance agencies are now employing satellite imagery and environmental modeling to predict these population spikes before they result in human clusters. While some headlines categorize these changes as a climate catastrophe, public health officials remain focused on the data-driven reality. As habitats change, the boundaries between human development and wildlife reservoirs are blurring. This shift necessitates a One Health approach where veterinarians, ecologists, and physicians work in tandem to monitor the health of the environment as a direct indicator of impending human health risks. Current laboratory research is also investigating whether these environmental stressors are putting selective pressure on the virus itself, though verified evidence of increased viral mutation or enhanced transmissibility remains a subject of ongoing study. As the global community grapples with the reported increase in hantavirus activity, public health authorities are prioritizing aggressive prevention and surveillance strategies to mitigate the risk of zoonotic spillover. The primary directive from the Centers for Disease Control and Prevention and the World Health Organization remains the elimination of rodent-human interfaces. This requires a comprehensive approach to integrated pest management that extends beyond simple extermination. Individuals in high-risk areas are advised to perform a thorough audit of their dwellings and outbuildings, sealing any gaps or crevices larger than 1/4 of an inch, roughly the diameter of a pencil, using materials such as steel wool, caulk, or cement, because rodents are attracted to food and nesting materials. Health officials emphasize the necessity of storing pet food and grains in thick plastic or metal containers with tight-fitting lids and maintaining a perimeter of at least 100 feet around homes that is clear of brush, wood piles, and trash. These structural interventions serve as the first line of defense, preventing the establishment of the rodent reservoirs that carry the virus into human environments. The methodology of cleaning infested spaces represents a critical point of public health education, as improper cleaning is a leading cause of aerosolized transmission. Authorities explicitly warn against the use of brooms or vacuum cleaners in areas where rodent droppings, urine, or nesting materials are present. These methods stir up dust particles, allowing the virus to become airborne and easily inhaled. Instead, the established protocol involves a wet cleaning technique. The contaminated area must be thoroughly sprayed with a disinfectant, such as a solution of 1 part household bleach to 9 parts water, and allowed to soak for at least 5 minutes. This process inactivates the virus before it is physically moved. Only after this soaking period should the materials be wiped up using paper towels or rags, which must then be disposed of in sealed plastic bags. For professionals or individuals cleaning heavy infestations, the use of personal protective equipment, including non-porous gloves and N95 or N100 respirators, is considered mandatory to ensure safety against the highly stable viral particles that can persist in the environment for several days under the right conditions. On an institutional level, the response relies on a robust surveillance network that tracks both human cases and the prevalence of the virus in wild rodent populations. This sentinel monitoring allows epidemiologists to issue localized warnings before a human cluster emerges. However, health officials remain transparent about the honest limits of current scientific knowledge. One of the most significant challenges is the extended incubation period of hantavirus, which can range from 1 week to 2 months. This delay complicates contact tracing and the identification of the original source of exposure, especially in mobile populations or international travelers. Furthermore, while experimental DNA vaccines and targeted monoclonal antibody treatments are currently in various stages of clinical trials, there is no widely available vaccine or specific antiviral therapy. The medical community continues to struggle with the nonspecific nature of the early prodromal phase, meaning that many patients do not seek specialized care until the disease has progressed to the critical respiratory stage, where mortality rates sharply increase. Ethically, the reporting of hantavirus requires a delicate balance between maintaining public vigilance and avoiding unnecessary alarm that could lead to the stigmatization of rural communities or affected regions. The One Health framework, which recognizes that human health is inextricably linked to the health of animals and the shared environment, has become the standard ethical guide for modern epidemiology. It shifts the focus from reactive treatment to proactive environmental stewardship. Officials stress that while the current data shows a concerning trend, the virus remains relatively rare and is not a candidate for a widespread pandemic in the traditional sense, given its primary reliance on rodent vectors. The ultimate goal of current public health policy is to empower the public with factual, actionable data that reduces individual risk while supporting the global scientific efforts to better understand the ecological triggers of this formidable pathogen. As surveillance efforts continue to expand in response to shifting global climates, staying informed through verified health channels remains the most effective tool for personal and collective safety. For more in-depth reporting on emerging public health developments, consider subscribing to this channel.